Amber.
Hi.
Hi, my name is Lorraine, and I'm going to be your nurse today. And I'm here because we're going to do a musculoskeletal, so that means we're going to check your muscles and for strength and for range of motion or how you move them. And then we're also going to check your brain since you fell the other day. I want to make sure that you don't have any residual from that fall.
Okay.
All right, so it'll take us about 10 minutes. While I clean my hands here, do my hand hygiene, I'm going to ask you a couple questions. Do you remember losing consciousness when you fell?
No.
Okay, wonderful. And have you lost consciousness since the fall?
No.
Okay, perfect. All right, any problems, any pain or discomfort in any of your muscles, back, arms, feet, neck? Okay, perfect. So I'm going to be asking you a series of questions, and some of them seem silly, but I noticed that you're alert, and I'm wondering, you told me your name is Amber. Can you tell me your date of birth?
12/20/1999.
Okay, excellent. So, and your first and last name again?
Amber Pashley.
Okay, perfect. So could you tell me where you're at?
The hospital.
Okay, excellent. All right, and can you tell me about what time of the day it is?
6.
Okay, perfect. So about 6 in the evening. It's actually about 7:16, but it's evening. So very good. So you're alert and oriented. Your behavior is appropriate. You seem to be in a spry, good mood. You've got a smile on your face and you're chuckling. Your hygiene looks good. You don't smell or anything like that, so that's great. Now I'm going to give you a set of numbers, and then I'm going to have you say them backwards for me, okay?
Okay.
Okay? They're very easy, okay? This is no trick. 1, 2, 3, 4, 5.
5, 4, 3, 2, 1.
Okay, perfect. So your immediate recall is good. I'm also going to tell you 3 words, and I would like you to think about those 3 words, say them back to me, and remember them. And before we're done, I'm going to ask you to tell me what those 3 words are, okay? Chickens, Andrew, and spring. Can you say them back to me?
Chickens, Andrew, and spring.
Okay, perfect. Don't let me forget to ask you those before we begin in this assessment, okay? Can you recall your first Christmas? Do you remember something? What's the most special Christmas that you can remember?
This past year.
Okay. So, can you tell me about a special birthday party that you may have had? Maybe back in the distance. I'm trying to test your long-term memory.
At Pizza Ranch.
Oh, okay, perfect. So you remember having a birthday party at Pizza Ranch?
Yeah.
Okay. All right, excellent. Now I'm going to ask you another question. I'm going to ask you to tell me what you were doing when you fell.
Riding my horse.
Riding your horse, yes. Good thing you had your helmet on, right?
Yeah.
Yes, this could have been much worse. And so I'm going to ask you some questions about your abstract thinking. I'm going to give you a phrase, and I'd like you to tell me what that phrase means to you. A picture is worth 1,000 words.
That phrase means that taking every little moment.
Okay, perfect. All right, and now I'm going to ask you to associate some words for me. So I'm going to give you a phrase and start the phrase, and I'm going to ask you to finish it, okay? A bird is to the sky as a fish is to
the sea.
Okay, perfect. Perfect. And then one more question. What would you do if you locked your keys in the car?
I would get a whip and get them out.
Okay, because that happened to have happened, right? And you were successful, so that works out good. So, all right. So now what I'm going to do is I am going to use a Q-tip. Oh, we're going to have Kitty join us. I'm going to use a Q-tip. I'm going to break it off to make a sharp end. Don't worry, I'm not going to hurt you. To make a sharp end, and then a cotton ball for a smooth end. And I'm just going to take the back of your hand, and that's sharp, and this is dull. Could I ask you to take your glasses off? Excellent. Now if you'd close your eyes, I'm going to touch around on your face, and I'd just like you to say where you feel it and if it's sharp or dull.
My forehead and dull.
Okay.
On my cheek and sharp.
Which cheek?
My left one.
Okay, perfect.
My chin and sharp.
Okay.
And my right cheek and dull.
Okay, perfect. So your sensory is good. And And now I'm going to ask you to do some range of motion exercises for me, okay? And we're first going to start with your head and your neck. So I'm going to have you flex your neck to your chin, and now I'm going to have you hyperextend your neck back all the way. Bring it to a normal stance. I'm going to have you move your neck to the right as far as you can, and to the left. Excellent. And now if you could bring it back to the center and rotate to the left and rotate to the right. Okay, perfect. No pain or discomfort while you were doing that? Okay. So I'm just going to place my hand here. I'd just like you to push against it while you're turning your head to the left. Excellent. And then the other way. And then I'd like you to push it with your neck back and then forward. Okay, excellent. Now what about your shoulders? Any pain or discomfort in your shoulders? Excellent. Can I have you bring your shoulders out to your side, bring them up over your head, bring them down in front of you, and can you put them in back of you? Okay, perfect. And are you able to put them back out and rotate? Any pain or discomfort when you're doing that?
No.
Okay, now I'm just going to palpate your joint, your shoulder joint, and I'm going to have you rotate again so I don't feel any lumps or bumps or any crepitus, so that's good. I'm going to check your elbow. First, I'm going to have you bring your elbow to your shoulder and back out. Perfect. And I'm going to have you bring your wrist towards your elbow and back out. Perfect. And can you rotate your wrist? Okay, good. Now I'm going to just feel your elbow while you're doing that. Excellent. And then I'm going to feel your wrist while you're doing that, and you're rotating. No pain or discomfort. All right, perfect. I would do that on both extremities. Now I'm going to just test some strength. So I'm going to have you push against my hands. Excellent. And push against my hands. Very good. Could you put your hands out in front of me? And I'd like you to bend your forearms. Perfect. And back. Excellent. And now we're going to just check your hands. I'd like you to squeeze my fingers as hard as you can. Okay, perfect. That was equal. Your upper extremity strength is good. You're doing fantastic. So one more thing, I'm going to have you stand up. Oh, Kitty loves glasses. I'm going to have you stand up. And we're going to just check your spine. So if you could bend forward without hitting your forehead on the dresser. Okay, perfect. I'm just going to check that your spine is midline. Any pain or discomfort when you do that? Okay, excellent. Can you pull back up and hyperextend your back? Okay, good. Does that feel good? Okay, and then I'm going to have you rotate your back like this. Any pain or discomfort when you do that?
No.
Okay, perfect. Now we're going to have you stand over here where we can see you in the video. I'm going to have you can hold onto the dresser if you want to. Bring your right leg forward. This is flexion and back. Or excuse me, that was extension. This is flexion. And back to the ground. Perfect. And can we do the same thing for the other leg? Excellent. And now with the other leg, can we bring it out? And can you rotate? Okay, and can we do the same thing for this leg? Out and rotate. And now bring the leg in front of you. Bring your foot towards your nose and take your foot towards the ground and rotate your ankle. Any pain or discomfort? We do the same thing with the other leg. Forward, foot to your nose, foot to the ground, and rotate. No discomfort? Okay, perfect. So you can just have a seat and we'll test the strength in your lower extremities. All right, I'm going to just have you push up against my hands. Good. Now push down. Good. And pull against and forward. Excellent. And push against like a gas pedal and up. Okay, good. So strength is bilaterally symmetrical throughout. Now, we're going to do a fun test where we're going to check your coordination, okay? So I'm going to have you take your heel and run it down your shin on each side. Okay, excellent job. All right, I'm going to have you take your fingers out to the side, and I'm going to have you touch your nose with one finger at a time. Okay, now let's do that with our eyes closed. Very good coordination. Okay, our last test that we're going to do before we begin reflexes is I'm going to have you stand, and we're going to do what's called a Romberg test. I'm going to have you stand forward with your feet together, your arms at your side, and you have your balance. Now I'm going to have you close your eyes for about 30 seconds. 30 seconds is up. You did a really good job, so you have good balance. Okay, so the next part, little hand hygiene. The next part we're going to do is I'm going to check your reflexes, okay?
Okay.
All right, and I'm going to first check your bicep, which is right here. So what I really need you to do is relax, okay? And I'm going to hit my finger, not your arm, so you won't feel it, okay? Okay, good reflex. So that's the bicep. Now I'm going to do the tricep, so I'm going to have you dangle your arm, relax, relax. I'm going to put my thumb over the tendon, and I'm going to check for good reflex. Perfect. And I would do that bilaterally to make sure that they were both intact. And then I'm going to check your patellar reflex. So I'm going to have you bring your hands together like this and focus on your hands, and I'm just going to check your reflex. Oh, good. Your patellar reflexes. You have good patellar reflexes. You're doing an excellent job. I can tell that none of that residual from the fall is with you, so that's great. So I'm going to wash my hands. Now we're going to test your cranial nerves, okay? So the first thing I'm going to have you do is close your eyes. I'm going to check your cranial nerve number 1, which is your olfactory nerve. And I'm going to give you something underneath your nose to smell, and I would ask if you would identify that for me, okay? You want to close your eyes?
Coffee.
And one more thing, I'll have you close your eyes.
Cinnamon.
Yeah, the coffee's still in there, isn't it? You can open your eyes now. Perfect. Now I'm going to have you stand up, and I'm going to come over here to the Snellen chart, and I'm going to have you read the lowest line that you can.
Okay. C, B, E, K, J.
Excellent. 20/20. So I was checking cranial nerve 2, which is your optic nerve, and your vision is intact. Now I'm going to check your ocular nerve, another part of your ocular nerve 2, 3, and 3, which is your oculomotor, and 6, which is your abducens, okay? I'm going to have you take a peek at my nose. I'm going to bring my light up. I'm going to ask you to follow my light, okay? With your eyes only. I'm doing the 6 cardinal signs for extraocular movement to make sure that the cranial nerves are intact. And then I'm going to do accommodation. Perfect. And then as a good part of a neural check, we're going to just check that your pupils constrict. Okay, good. Good. All right. So now we checked cranial nerves 3, 4, and 6. We're going to check the trigeminal nerve, which we did when we did the sharp and the dull to the face. But we're also going to check the muscle in your jaw. If you would open and close. Good. No problems there. So your cranial nerve number 5, trigeminal nerve is intact. Now I'm going to check cranial nerve number 7, which is your facial nerve, okay? And so, do you have any difficulties tasting salty foods? Tasting salt in foods. Okay, perfect. Could you please smile for me? Frown? Frown your eyebrows? Perfect. Poke out your cheeks. Excellent. So cranial nerve number 7, facial nerve is intact. Cranial nerve number 8 is the auditory nerve. So we're going to do a whisper test. I'm going to come back here and I'm going to say a word and I'm going to ask you to repeat it, okay?
Okay.
Thank you.
Thank you.
Okay, and I'm going to do the same thing over here.
Thank you.
Okay, you really wouldn't use the same word, but we were just... So the hearing is intact. And could you hear that equally in both ears? Perfect. All right. Now we're going to check cranial nerve number 9, which is the glossopharyngeal. Okay, that's a great big old word, but it doesn't mean a whole lot. It just means your pharynx. So if I can hear that you're talking, so your vocal cords are intact. Here's a little drink. You want to swallow? Perfect. And now I'm going to have you open your mouth. Ah. Okay, uvula rises. So cranial nerve number 9, the glossopharyngeal nerve is intact. So is cranial nerve 10, your vagus nerve, because you're able to swallow and you're able to vocalize. And now I'm going to check cranial nerve number 11, which is your spinal accessory. So we've already done the range of motion, but I'm just going to have you push against my hands and raise your shoulders. Perfect. Spinal accessory nerve number 11 is intact. And then the last cranial nerve is hypoglossal. And so this is the fun part. You get to stick your tongue out at me. So if you'll stick your tongue out straight and then to the side. Okay. You did a fantastic job today. I'll let the doctor know that everything went really, really well. Your cranial nerves seem to be intact. You have good balance. You have good coordination. Your muscle strength is good. Hey, before we end, can you remember those 3 words I told you?
Chickens, Andrew, and Spring.
Excellent. You rocked it. Okay, cut.